Oh, here we go. Good day, everyone, and welcome to today's webinar. Our presenter today is Aspen Drood, manager of UT Arlington's Center for Rural Health and Nursing. At this time, all lines have been placed on mute to prevent any background noise. We will include a Q&A session during this webinar. Type your questions using the pane at the right of your screen. We'll try to get to questions as they arise and between topic changes. Please identify the name of your organization. Information about the Center for Rural Health and Nursing is available as a handout from the sidebar during this webinar in PDF format. Also available in the handout section is information about CIHQ accreditation and the schedule for future webinar dates. To view the handout section, click on the small orange arrow at the top of your screen to expand the menu. The webinar is being recorded, will be available on the CIHQ ARS Partner Webinar YouTube page within a couple of business days. It's now our pleasure to begin this interview session. So welcome, Aspen. This is a spotlight on UT Arlington Center for Rural Health and Nursing. Why should we focus on what's happening out in the sticks? So we'll begin with Aspen. Please tell us a little more about yourself and the center.
Yeah, thank you, Michelle. I appreciate it. Hi, all. My name is Aspen Drood. I manage the Center for Rural Health and Nursing at UTA, like Michelle said. So my background actually was not in healthcare. So I actually started in business. And so I went to undergraduate. I got my degree in management. I went and got an MBA in management, engineering, and technology development. And I thought that I really wanted to do something in technology. And so I wanted to likely do something in project management. And so I worked for Tesla for a year. And then I needed a change. And so I started looking. I actually took a career aptitude test, and the career aptitude test told me that I should look into being in higher education. And so I did that, and I kind of fell into this role. UTA had just gotten funding to start a new Center for Rural Health, and I knew very little about healthcare. My mom was in nursing, and so I knew a little bit, but not much. And rural nursing, the only thing that I knew about rural was that my great grandma had a farm in rural Georgia, and that was, a little bit of my experience with that. And so really, it was a steep learning curve for me. But I very quickly found that I was very passionate about it. Most of the people that I talk to are very passionate. People who work in rural, they tend to love it. They tend to have a passion for it. Their families have lived there, they've grown up there. And so it really is, it's a strong set of communities. And so I kind of fell into love with it. I'm currently I'm pursuing my PhD at the moment in educational leadership and policy studies, and I plan to utilize that to be able to do some more research on rural communities, but from the education side. So that's a little bit about me. I'll tell you all a little bit about the center as well. So the center was created in October of 2021. So we're still a fairly new center. We're 3 years old this month, actually, so very exciting. And so basically our biggest goal is to increase access to rural healthcare resources in rural counties in Texas. And so we do that through, a variety of ways that we're going to get into a little more detail about. I do want this to be as interactive as possible. So if y'all have any questions, while we're going through this, feel free to put them in the questions box.
All right, Aspen. First question, why the focus on rural healthcare in Texas? Some of the audience might not be from this great state, so why this focus?
Sure, absolutely. So Texas is large, as all of you know, and because it's so large, a lot of rural areas lack access to healthcare, mainly because of the large geography of Texas. And so we have over 4 million people living in rural communities, which is more than some entire states, right, in the United States. And so that's one reason why it's really important. But there's a number of other reasons why it's also important, right? So most of our rural communities in Texas, they face a lot of barriers to healthcare access. So typically that's going to include like a shortage of healthcare providers, little to no availability of specialized care, great travel distances for medical facilities, and sometimes that can lead to delayed diagnoses and treatments, which of course can unfortunately lead to fatalities. And certainly poor health outcomes. A lot of what we hear from our providers in rural Texas is they talk about, there's a provider shortage. While I'm sure a lot of you are familiar with that, if you're working in healthcare, there's a provider shortage everywhere, but it's exuberant in rural communities. And so that's a big piece. Rural communities also around the United States, this is not just in Texas, but of course I'm Texas focused. So in communities, rural communities specifically, there's a higher prevalence of chronic diseases, right? So rural populations, they have a higher rate of chronic conditions. So like diabetes, heart disease, obesity, alcoholism, substance abuse usage. So we're, trying to combat all of those. There's higher health disparities, right? So unfortunately, rural communities are also considered a vulnerable population. They're aging communities, they're typically older, and they're typically lower income. And then on top of all of that, right, policy typically doesn't focus on rural communities. COVID kind of changed that a little bit, but the reality is that there's just not a lot of people that are policymakers that are really caring about rural communities, because that's unfortunately the least percentage of their votes where that comes from, right? So we want to make them care and understand why rural communities are so important. And we talk about vulnerable communities a lot, but typically rural is not included in those. And so we want to make it to where it is included, and to where it starts to be commonly talked about, as we really need to help with increasing resources in those areas, and we really need to assist them in basically making sure that they have the same equity, right, that everybody else does, and in the ability to receive healthcare in their own community.
Outstanding. So next question, what exactly is the center at UTA doing to alleviate the rural workforce concerns?
Sure. I don't know that anybody could fully alleviate the workforce shortage, unfortunately. However, us being a university, so the University of Texas at Arlington is the #1 producer of baccalaureate nurses in the United States. So we produce a lot of nurses. And so with the center being created, we want to make sure that rural nurses get that same opportunity. And so if you're not familiar with how nursing programs work, basically a nursing program, the student comes into the program, they do a couple of years of didactic content, so content in a classroom, and then their next couple of years are clinicals. And so they actually go to the hospitals and they do rotations in certain areas. So like the emergency room, they do women's health, they do pediatric care, and so among others. And so with that, we have been able to build a liaison team. That liaison team actually goes out into the rural areas and speaks with the hospitals, meets with them, identifies some of their needs, and then also identifies those that are in that rural community that are interested in becoming nurses, or maybe they're already nurses and they want to become an advanced practice nurse. Or maybe they want to go back to school for something else healthcare related, right? And so that team helps with identifying those people and getting them into our programs, but they are able to do those programs fully online from their home community. And then we try and get them clinical placements nearby so that they're not having to drive 2 and 3 hours one way just to get these clinical rotations that are needed to get a degree and to become a nurse. And so that's a a large part of what we do. And then we also visit clinics for the advanced practice nurses. Typically, they can work in a hospital, but typically they're working in clinics. Their rotations are a little different. They work a little differently. So that's a big piece of what we're doing for workforce shortage, right? We're trying to kind of keep them in their home community in the rural areas to where they don't have to worry about the transportation piece. And then another piece is continuing education, but I think that actually moves into our next question, right, Michelle?
Yes, ma'am, and you actually have a question around this as well.
Great.
For individuals not in healthcare, but concerned about healthcare access, how can we get involved to help? That's from Shelley Bozeman.
Yeah, absolutely. Hi, Shelby. Good to see you here. Thanks for coming. So obviously healthcare includes everybody, right? Every single person on this planet, they have to find healthcare at some point in their lives. And so, you know, your life kind of starts and ends with the healthcare system, so to speak. So I think it is important for those that aren't in healthcare to figure out, like, how can my voice be heard? And I would say the number one way to do that is advocacy, right? And advocacy, I think sometimes can be looked at as your political leanings, but that's not at all what advocacy should be. Advocacy should be going to your local policymaker and expressing your experiences, right? So say you live in a rural area and you know you've experienced poor health outcomes because you don't have access to health care. Those are the people that like they need to hear from. Or maybe your grandmother lived in a rural area and you know she unfortunately had to deal with poor health outcomes because of her location. I think it's those types of stories that typically policymakers hear and they're like, oh, I see how this is affecting multiple groups of people. It's affecting a whole lineage, not just, you know, one person. And so I think advocacy is probably the best way. You can advocate in multiple ways. You don't have to go to a policymaker. You don't have to send letters. You can advocate just by doing yourself the service of, you know, starting to do research on how rural communities are affected in certain areas. And like I said, I mean, my PhD is going to be in education. It's not going to be in healthcare. But education and healthcare are very closely linked, right? So I think being able to advocate on multiple levels for rural communities is really, really important. And there are other areas that, you know, even if you're not in healthcare or education, that you can certainly advocate for rural communities in. I mean, technology, roads, things like that that you know you don't necessarily think of on the day-to-day.
Okay, so continuing education, you mentioned that a couple of times. What does the center or UTA offer for continuing ed to those that are interested in learning more about rural healthcare?
Yeah, sure. So we offer actually a lot of continuing education opportunities. And so if you're not a nurse, nurses have to get a certain amount of what we call CEUs, so continuing education units. And it's basically just, like she said, continuing education, right? And so they have to have those every 2 years to renew their license. So we have gone and we now offer quite a few of those every year. And so we offer them in a couple of different ways. So we offer them, so one of the handouts, actually, I'm going to pull this over. One of the handouts that is to the right of your screen under handouts. So I think it's the third one down. So this actually shows some of the things that we offer. This isn't everything that we offer, but it does give kind of a comprehensive overview. And so some of the things that we offer for continuing education, we do have a seminar series that we host monthly. We talk about a variety of rural health topics. We talk about research sometimes. We talk about maybe something that an organization is doing to kind of combat some of the crises that rural health communities experience. So we kind of do a variety of different things, and those are all going to actually be located here on our event calendar. So if you just click in this, it'll actually show what our next seminar series is. So our next seminar series is going to be in November because we have a conference this month. And it's going to be a focus on critical access and rural emergency hospitals. And this is by one of our researchers here at UTA who is also faculty. So if you're interested, you can go on our website and you can just, you can sign up straight here at the Google Calendar. You can register on this link. It is a Teams link, so pretty simple there. In addition to our seminar series, and we also, sorry, one more thing I just remembered. You can go to previous events and just click on that, and this actually will show you, we have videos, and this will take you straight to YouTube as well. One second. Previous events. Well, we have I'm sorry, it's under resources. I lied. It's under resources, seminar series, and then previous seminars. And then you can actually scroll down and this will take you directly to a YouTube page to be able to watch some of those videos. So if you are interested, I strongly recommend, this has been a really, really great seminar series. And so we continue that almost every month unless we have another event happening. We also have a podcast. This is not for continuing education hours itself, but it is really great if you're interested in learning a little more about nursing, a little more about rural health. And so there's the link there as well. We do offer a grant writing course. This is available for everyone. So it does fill up really quickly. So something that we kind of were getting feedback on pretty often was that, rural hospitals, they lack funding. And so, hospitals in urban areas, right, we've got Baylor Scott and White, which is a really big one around here. And actually, they do a lot of great things for rural communities, but needless to say. So they actually have like a team of grant writers. And so unfortunately, rural areas, they don't have that same luxury. And so because of that, we created a grant writing course. And so it is an 8-week fully online course. But it's guided by the Center for Rural Health's grant writer. Her name's Myanda, and anybody can sign up for this course. So if you all are interested, I would strongly recommend emailing Myanda and asking her when our next grant writing session is going to start. It does fill up really quickly, so if you're interested, I would strongly recommend doing that sooner rather than later. And then we have a writing for publication course as well, and this is really meant for people who are interested in publishing, but maybe haven't published, or maybe have only published a couple times and just need some assistance. And so that's ran by Joy Dawn Baker. She is really phenomenal. I've taken the course myself, and I really, really enjoyed it. So if you have any interest in publication, and it doesn't just have to be rural health, but if you're interested in publication, I would strongly recommend reaching out to her for more information on that as well. Now, our biggest offering for contact hours every year is our conference. So our conference this year is October 23rd and 24th. I know it's last minute, but if you go on our website, if you are interested, it is offered virtually and in person. So you can actually go right here to event calendar and then 2024 Rural Health Conference. And then you can find some more information on the conference here. We do have a rough draft of the agenda. So if you're interested in kind of the topics that we talk about, and it's hosted at UTA if you're interested in attending in person. We do still have some community partner scholarships as well. It just allows you to attend the conference for free. So if y'all are interested, you're more than welcome. You just scroll down right here, and it's under scholarships. So, and then you would just click on this, fill out the form, and then, yeah, I would get back with y'all in just a couple of days. So in addition to all of the things that we offer, we also partner with a lot of external organizations as well. And those external organizations, we partnered with the Opioid Response Network to host an opioid event. We partnered with the Department of Homeland Security to host an opioid abuse and human trafficking awareness event. This next year are actually partnering with the Rural Nurse Organization to host an international conference. There's more details on that coming soon. And then we're also partnering with the Asian American Pacific Islander Nurse Organization this next year as well to host an event for them. So we try and partner with a variety of external organizations so that we can kind of meet all of the varying needs of the rural areas. So does anybody have any questions about continuing education?
Okay, it doesn't look like anything is coming through. So other unique projects the center has done or is planning to do for rural communities?
Sure. So a lot of what we do has came from feedback that we've gotten from our rural partners. Most of those are hospitals and clinics, but some of them are, students who come from rural communities, or just rural people in general that we've just kind of came across and we've gotten their opinions. But a lot of the things that we've heard is that nurses are not getting the support that they need right when they come out of school. And so we have created a residency program that is, it's a year-long program. It's fully online and it's only for rural nurses. They do have to, they had to have been nurses for between 0 and 24 months. And they have to work or live in a rural community. So a big reason why we did this is because the statistic shows that 33% of nurses are leaving bedside nursing within their first year because they don't feel supported. They think that school didn't necessarily prepare them for how difficult the working world really is. And so we're trying to kind of combat that. So the center has now created this online residency program. It actually just started last month. And it's going really well so far. So we've gotten a lot of positive feedback so far. We'll continue to get feedback and make those adjustments as well. So that's one thing that's kind of unique that we've started offering. Another thing that's really unique is we have actually created a rural health certificate program that's going to be launched in spring of 2025. And so that program we have 2 certificates. We have an undergraduate certificate and a graduate level certificate. Both are 3 courses, 9 credit hours. You can also find a little more information about those on our website as well, but it's not on our regular website. So it's actually on, let's see, it's on the UTA website. So I can drop this in the chat as well. But like you just saw that I did, you can type in UTA Rural Health Certificate and it'll pull up both. And then it'll have more information on the courses, admission requirements, that type of thing. So you do have to be admitted into UTA. This is an interdisciplinary program, so you don't only have to be a nurse or in nursing. You can be in any healthcare discipline and get this certificate, no matter kind of where you are. So those are some kind of unique programs that the center offers. We also offer 2 very unique pieces of technology at UTA. So I'll start first with one that we just got delivered and we began using at the beginning of this year. So we have something called an Igloo. And so the Igloo is basically a virtual reality room that students can walk into and get specific training on certain things that they might see in the workplace. So one that I'll give you an example of is postpartum hemorrhaging for women's health. And so we can actually recreate a postpartum hemorrhage. And the reason that we do this is because the data has shown that, when nurses, they first start out and they say they go into an emergency room and they see a postpartum hemorrhage, their body is kind of in fight or flight mode, right? And so their body ends up stressing and they panic in some way. And so the usage of this fully immersive room is that they feel like they're in this experience and they feel like they're actually with a real patient, which, I mean, our mannequins are really amazing and they actually can fully produce this postpartum hemorrhage. So it's very neat to see. And it allows the student, for when they have to experience this again, their body feels like they've already experienced it, so they panic less. And that's kind of the goal, right? It goes with, like we were talking about earlier, the kind of the quality of healthcare and quality of the students that we teach. And so we're trying to produce not only the most amount of baccalaureate students, but we're also trying to just produce well-rounded nurses. And so I think that's really important to highlight. And another piece of technology that we actually have not gotten yet, but we are getting at the end of the year, and we're really, really excited to be able to offer coming in 2025, is that we have a mobile simulation lab. And so oftentimes rural communities, they don't have access to simulation labs like a lot of the urban hospitals do. And so the nurses can't go and learn new things in the simulation lab or practice certain things in the simulation lab because they don't have one. And so our goal was to be able to bring these simulation labs to the rural areas. And so that's what is coming in spring of 2025. So there'll be more information on that coming on our website. We will likely have a ribbon cutting and that kind of thing, and likely a couple of videos that'll come out too. And so we are going to be working on that. We're really, really excited to offer it.
We have a question from the audience. Joseph Wilk says, Aspen, good to hear from you again. I realize UTA is the largest educator of nursing. However, how does your center interact with other areas of the university, such as the engineering or business colleges, their faculty and students?
Sure, that's a great question. Hi, Dr. Wilk, it's great to see you. Dr. Wilk actually was one of my professors in my master's program, and one of the reasons why I enjoyed project management so much, so thank you for the question. So we actually do quite a bit of collaboration. I feel like universities are known for how siloed they are, right? So usually if you're nursing, you stay within nursing. But we actually have done quite a bit with engineering, specifically because of all the technology stuff that we're doing. It requires a lot of coding. It requires a lot of kind of unique skills that typically nurses don't hold. So not to say they can't hold them, just that normally they don't. And so we have partnered with the College of Engineering on the Igloo, and we probably plan to partner with them with the mobile simulation unit as well, just so they can kind of help us, make sure that our simulations that we provide are quality simulations. So we have partnered with them. We've also partnered with the College of Education. We have partnered with, and who else have we partnered with? I know we've partnered with other, I know that we've partnered with, of course, other healthcare areas, right? Social work, public health, kinesiology. We haven't done a ton with business, but we're definitely not against it. I'm open to kind of partner with anybody who has interest in doing anything regarding rural health. So we actually have been talking about getting a business student over in our college. And we also have had quite a few computer science students that have worked for the center as well while they were still in school. So yeah, that's a lot of the ways that we partner, but if you have any other ideas on ways that we can partner with other areas of the university, I would be happy to take any of those ideas.
Okay, Dr. Wilk said you're welcome. Okay. So what are some upcoming things the center will offer that you think would be good for anyone who has an interest in rural health?
Sure. So definitely our conference. Our conference, we talk a lot about a lot of different rural health topics. And so kind of wherever you're focused, if you're in a hospital, if you're working in a university, even if you're not healthcare related, I think that our conference is #1 that I would recommend if you're interested in rural healthcare to any degree. We're also hosting the International Rural Nurse Organization Conference in 2025. That'll be in May. I will put up this web page here because it is actually on our website as well. This conference is also really, really beautiful for a variety of rural healthcare topics. And so this conference is a little larger than ours. Ours is probably about 150 people. This one is about 400. And you're meeting people from, I mean, literally all over the world. It's an international conference, so it's really, really great if you're trying to kind of hear some different opinions and from different healthcare systems and different education systems, and it's always really interesting to hear kind of what different countries are doing in terms of their healthcare system, especially in comparison with ours, right? So those are two of the larger ones that we have coming up. Like I said, we also have the Asian American Pacific Islander Nurse Organization. So if that applies to you, you'll be seeing some more information about that in the next month or two as well. And those are probably the large ones. If you're in Texas, I would strongly recommend looking into Torch is the organization. It's the Texas organization. Let's see. Yeah, so this is the Texas Organization for Rural Hospitals and Clinics. And they are the largest rural health organization in the state of Texas. They're really, really great. If you're a nurse, that rural nurse organization, I would strongly recommend. They always have really great things to add, and they always are hosting really, really great events. And then on a larger scale, the National Rural Health Association, NRHA, they host so many amazing things. And if you don't know how to get into advocacy, NRHA is definitely how I would recommend that you jump into that. Because they host a policy conference in February of every year, and they actually give you an opportunity to go and talk to your legislators about, like I said, right, the research that you've done and kind of your experiences with rural. And so if you're interested in any of that, I strongly recommend that, that's how you kind of can get a little more involved or through a lot of those events. But if you just kind of want to dip your toe in, right, the seminar series is a great way. I'm happy to meet with you one-on-one if you have any thoughts or questions or just want to chat about rural health. I'm really happy to do so.
Okay, outstanding. So you've talked about some of the projects and programs that you have upcoming. Can you talk a little more about your partnerships, like the one with CIHQ?
Yeah, absolutely. So CIHQ, so Michelle and I met, I guess it's been probably about 2 years now. But Michelle and I met because she thought we could have, equal interest in healthcare in general. And so she's like, let's have a conversation. So we started talking, and then I attended the CIHQ conference, which actually just passed a few weeks ago. Last year, and it was really great. I mean, all the information, health quality, we talk a lot about it in healthcare, but this conference was just focused strictly on that. And so I thought that was really unique. And so Michelle and I since then have kind of worked together to be able to provide a lot of different continuing education opportunities. And so CIHQ is just one organization that we've done that with. We're very lucky that, most people in Texas, they do want to work, they do want to partner, and they do want to collaborate. And so I think that's a really beautiful thing. We've worked with, other than, the ones that I named earlier, we also have worked with a couple organizations. We've worked with WellPoint, and they actually came to UTA and they hosted an event that was focused on maternal health, which in Texas, maternal health, we're actually 48th in the nation for maternal health, which is really unfortunate. And so we have a higher percentage of disparate communities having fatalities when giving birth or within a year after. And so that's really unfortunate. And so how do we fix that, right? And a lot of that is because we have maternal health deserts. So we have large, vast areas in Texas that there are no women's health clinics. And of course, that's only been exacerbated because of some of the policies that have came to fruition in the last year or 2 years. And so we've done some work with a couple organizations on that. We have had organizations sponsor us to multiple degrees. We have WellPoint actually as one of the organizations that they provided a scholarship for rural students that attend UTA. And so that's obviously really huge for us as well. And then there are other organizations that, have worked with us anonymously and just said, we just want to help, and, we don't want any We don't want, you know, our name out there for it. We just really want to give. And so I think it's really beautiful. But honestly, I think a lot of the partnerships have to go out to our rural hospitals and clinics, because they're the ones who are doing the hard work, and we just want to be able to provide extra resources. So if you are with an organization that has extra resources to provide and you want to partner with us on being able to give that to our rural communities, let me know, reach out.
All right. Do we have any more questions from the audience? You just might get some of your day back, everyone.
Sure. Well, I'm going to post my business card. Give me 1 second to pull it up. Here we go. So I'm going to post this. If anybody wants to reach out, please feel free. I will zoom out on this because it's very large. Feel free to reach out. I'm happy to chat with you, like I said, about pretty much anything. If you just want to talk about rural healthcare and get a better grasp on it, I'm happy to chat. If you are with an organization that, you know, wants to provide resources but doesn't know how, I'm happy to chat. If you want to advocate and you don't know how, I'm happy to chat. So feel free to reach out directly. My email's on there, aspen.drude@uta.edu, and then the CRHN email is our office email. So that kind of, if you actually go to our contact page on our website, that's where it's going to send you, is that CRHN email. If you pop by the office, I'm there every Monday, Wednesday, Thursday. I'd love to meet with you. And if you want to have a phone call, my phone number is on there too. So feel free to reach out.
All right, everyone. We'll leave Aspen's business card up for the duration until you all decide to log off. Aspen, thank you so much for your time and talents today. I can't wait to come to your conference later this month and continue our partnership. So thanks very much.
Thank you for having me, Michelle. I really appreciate it.
Of course.